CRC is a licensed, nonprofit counseling clinic whose mission is to help our clients find hope, healing, and freedom from the impact of physical, sexual, and emotional abuse. In addition to this, we make certain that no one is turned away due to the inability to pay. Hi, I'm Colleen. There are many wonderful qualities about the Twin Cities, and I'm grateful to live in such a resourceful community. I'm impressed by the number of organizations, both public and private, that exist for the purpose of serving our community. I have learned as the Executive Director of Christian Recovery Counseling that one of the biggest challenges for these organizations is getting the word to those who need their services. Dr. Julia Kidwell is the Clinical Director of Christian Recovery Counseling. I have asked her to help us identify certain resources and when it would be best to utilize them. Thank you, Dr. Kidwell, for joining us today.
Thanks for having me.
Absolutely. Dr. Kidwell, a lot of people are not clear on the difference between a psychologist and a psychiatrist. How do I know whether I need to call a psychiatrist or a psychologist?
So great question. So both a psychiatrist and a psychologist are mental health professionals, and they really differ in their training. So a psychologist typically has their PhD and went to graduate school. They conduct psychotherapy with clients with a variety of issues such as anxiety, depression, things like that. Now a psychiatrist typically has their MD and went to medical school, and a psychiatrist's main focus is going to be on medication management, prescription, and assessment. So certainly if you are looking for that, then a psychiatrist is a great option. Psychiatrists occasionally too will conduct a little bit of therapy, but primarily they do the medication piece. If you feel like you would benefit from meds and aren't sure where to start, a great place is with your primary care doctor. They can help assess that, and if there's a need for even more in-depth psychiatric care, they can then typically give a referral to a psychiatrist. If you don't have a primary care doctor, you can always contact your insurance company. They'll be able to help you find a provider that's in your area and hopefully a network too.
That is great information. Nearly everyone, if not everyone, experiences sadness or just sometimes a feeling down. How do we know when it's appropriate to seek help for what we're feeling?
So everyone really experiences sadness. That's a very normal human emotion. But depression really differs in intensity and severity. So sadness typically will last a few hours, maybe a couple of days, but depression often lasts days, weeks, months, even years. Sadness typically goes away without much intervention. Depression oftentimes does not go away without medical intervention. Another big difference is that sadness oftentimes does not impact functioning, but depression typically does. So in cases of depression, it can be loss of interest in activities, loss of motivation, hopelessness, helplessness, and also it can really impair functioning. So trouble going to work, changes in appetite, changes in sleep habits, all of those things are really hallmarks of depression. Also, typical sadness does not lead to thoughts of harming oneself. Depression, especially in more severe cases, can lead to thoughts of harming oneself, wishing one was dead, things like that. Certainly if you have those symptoms that are more characteristic of depression, that's when it is important to think about seeking out help.
Sure, okay. You know, of course, many of the clients who come to CRC are seeking our help because they've experienced abuse. But some of the people watching Minding Your Mental Health today might not know what to do if they're experiencing abuse. What are resources available for them?
So there's a couple really great hotlines and websites that people can reach out to. So a few that we'll post on our website and will be shown in this video. The Minnesota Domestic Violence Crisis Line is a great one. And the National Domestic Violence Hotline is a great one. Those are wonderful resources that people can reach out to. Also a few really helpful websites, cornerstone.org and the domesticabuseproject.org. Both of those can help people identify abuse, develop a plan to get support, and if necessary, get out of that situation. Also, I really encourage people, if they do feel like they're in that type of abusive situation, think about a friend, trusted loved one that you can confide in to get additional support. That's always a wonderful thing to do. And if you're not sure how to get additional support too, reaching out and finding a therapist, whether it's CRC, a different agency, will kind of post those as well. How to find a therapist, that's a great option two. And of course, if you're in a crisis situation, you feel like you're in immediate danger, 911 or nearest ER are wonderful options too.
Great. That is great resource information. You know, oftentimes there are people who experience really sad feelings where it's so sad that they want to end things. Maybe they've lost all hope or feel like they want to do something to hurt themselves or someone else. Sometimes people are just in a state of crisis. What should they do at that point?
So great question. So if someone truly is in a state of crisis, they feel like they're a danger to themselves or others, then it's time to call 911 or go to the nearest ER. A couple other really great resources if they believe they're in a crisis situation is the Crisis Connection. That's a hotline that's open 24/7, or the National Suicide Prevention Hotline. Both of those are open 24/7 and are wonderful resources for people to call. Here in the Twin Cities, COPE, or the Community Outreach for Psychiatric Emergencies, is a wonderful resource. They can actually send a mental health professional or assistant to your location to help assess you if you're in danger. That's a wonderful resource that we have in the Twin Cities. And of course, another great step if you believe you're in crisis is to let someone else know. So if maybe that's a friend, family member, but find someone that you can confide in to get support and assistance. And lastly, if you feel like you are safe, you're not a danger to yourself, but you do feel like you've lost hope, you can always start with your primary care physician or reaching out to a mental health professional, like finding a therapist. They can work with you on a plan to help feel better.
Excellent. You know, there may be some people watching today who have a loved one who suffers from mental illness. What are some of the signs or indications that that person with mental illness needs some further assistance?
Yeah, great question. So a wonderful resource is NAMI, the National Alliance for Mental Illness. They have wonderful information that we'll post their website. They have great information for family members that are concerned about a loved one. They have great resources for family members that might be concerned or worried about a loved one. Beyond that, there are a number of signs, indicators that people can look for in their loved ones if they're concerned. So a big one to look for is changes in functioning. So this might include withdrawing from activities, not doing things that someone previously enjoyed, and then sudden changes in lack of participation, those types of things. That's a big indicator. Changes in academic functioning or functioning at work is also huge. If that person is missing work, or for teenagers, if grades suddenly decline. Also in teenagers, a big indicator can be behavioral problems. So irritability, anger, aggression, all of that oftentimes is indicative of a mental health issue. Crying frequently, lacking motivation, lacking energy, all of that also can be an indicator. And I would also encourage people to look for in their loved ones if their loved ones really changes their opinion of themselves. If they, for example, talk about their life is worthless or hopeless or helpless, that all can be really important to attend to as well. So if people do notice these signs in their loved one, I'd encourage people to talk to your loved one directly. Don't blame, don't criticize, but gently, kind of lovingly confront them. Express that you are concerned, that you care about them, offer your support. Talk to them about developing a plan together and finding ways that you can collaboratively get supports in place for them. That's really one of the best ways to do it.
Why don't we all do that? That would make things so much better, wouldn't it?
I know, easier said than done, right?
Yeah, this is true. Well, thank you so much, Dr. Kidwell, for helping us become more aware of the resources that are available to us. We have only scratched the surface of what is available, but know that this is a good starting place. We hope that you have found this episode helpful as you continue to find value in minding your mental health. Be sure to share this video with anyone you feel could benefit from the information we have provided. As always, we like to leave you with a word of encouragement. This month's verse comes from Psalm 34:17. When the righteous cry for help, the Lord hears and delivers them out of all their troubles. We are happy to be a source of information and encouragement. I invite you to participate in minding your mental health. For more information on how Christian Recovery Counseling can help you or a loved one, check out our website at christianrecoverycenter.org or give us a call at 566-0088.